for all your soothing medical ASMR. And join me on Patreon or OnlyFans for all the additional unseen medical. Good morning. Good morning. Welcome into the surgery. So pleased to have you in today. Do take a seat, won't you? Just pop yourself there. How are you doing? I've got some notes on you here. We'll just have a quick check. No, not an injection for you. Just a little pen for me. Just for doing my writing. Now, can we have a little conversation for a bit? I know that I've seen you before, and I'm very impressed that you're keeping up with your men's health medical checks. It's very good, honestly. Can't tell you how many of my patients just ignore the letters that come out to them. Not you, though. Right. Now, do you remember the procedure? Do you know what we'll be doing today? That's right, just a very quick, all-over MOT. So I'll do a little check on your heart. We'll just have a listen to your chest, make sure everything's clear there. Then we'll be having a look at the downstairs area, just having a little quick check. That'll be a visual check to begin with, and then a physical check. We may do a quick prostate check today, just to ensure everything's clear, no problems. It's better to be safe than sorry. How do you feel about that? Have you had one before? Okay. Well, I can't lie. There's a small amount of discomfort in it, but I can assure you I will be as gentle as possible. All right. And you're in very safe hands. So, that's right. So we're going to have a check. We're going to check the groin area. Just a little bit of flexibility around there. All right. Perfect. Well, I'm just going to pop on my PPE for today. So in general, can you tell me, how's your health been? Have we had any particular problems or anything that I should know about? Right. And you've been feeling very slightly tired recently? Okay. Well, we can do some blood tests and have a little look at that. Have you been overexerting yourself particularly recently? Okay. Well, it may simply be that you are very tired from just simply working too much. But we can certainly look into that. It's very important that all these little signs are highlighted. It's actually very lovely to see you again. Now, before I put my mask on, let me just say, would you mind, there's just a little changing room over to the side there. You can pull the curtain across. If I hand you this gown, there you go. If you could just go and pop that on. That's it. You can take everything off for me. That would be really helpful. I'm going to need to get to your chest area first and then your lower nether regions. So just take everything off and just come out just wearing the gown. And if you wouldn't mind, while you're in there, you'll see there's some little yellow specimen pots on the side. There's a yellow sign next to them. And if you could try and do a little urine specimen for me, that would be really helpful. What you can do is just do the little urine sample, pop it in a little bag. You'll see there's a pen, write your name on it, and there's a box right next to it. So just pop that straight into the box. You don't need to bring it out or anything, and I'll collect that afterwards. Honestly, it's no problem at all. You go and get your gown on, and I'll just get myself all masked up for you. Okay, off you go. How are you doing in there? Good. Expect it's slightly nerve-wracking undressing in front of somebody other than your wife. You've nothing to fear. Nothing at all. Ah, there you are. Wonderful. Come and take a seat for me, please. Just sit there. Excellent. Lovely. Right. Let's have a little check on you, shall we? Just going to come in a little bit closer. Just have a look at your face and your eyes, all right? All right, I'm just coming in now. Have you, just going to press your face a little. Have you been experiencing any type of headaches at all? No? Good. Have you, just checking around your temples? Any other symptoms like nausea, excessive tiredness? You did mention you've been a little tired. Any nausea with that? No. Oh, well, that's good. All right. Hopefully it's nothing more than just overwork. Right. I'm just going to have a little check in your eyes, if that's all right. I'd like you to look left to right and right to left. I'm just going to follow my torch. All right, I'm just going to shine the torch, first of all, left to right. Can you follow that for me? That's it, looking left and then right. Good job. Let's take it back a little bit. Can you follow the light up to the right? Well done. Follow the light up to the left. That's excellent. Try not to look directly into it, just following the beam of the light. Can I just check your pupils a little? All right, just follow the light again. Let's take a look. Short left, left and right, left and right. Let's have a look at the movement there. It's all right. Can I check the other side, please? Just a little. Short, left to right, left to right, left to right. Doing really well. There we are. Well, if you didn't have a headache when you came in, you might have one now. No, I'm just joking. Everything looks perfect there. Not a single problem. Not one little thing out of place. Right, shall we have a check on that chest for you? What I'll have you do is I'm going to get you to turn around, please. I know the gown is open at the back, so I'm just going to have a quick check on your back, and then I'll turn you around. We'll drop the gown down, and I'll have a little check on your chest for you. All right? All right, lovely. So turn yourself around on the stool. That's it. Just going to open your gown up a little bit. Yeah, just open that up. There we go. Right. All right. Sorry, this is a bit cold. All right, we're just coming in on your back now. So pop that there. Just going to hold it. Just breathe normally for me, please. Just breathe normally. We'll breathe together. Are you ready? Breath in, just normal breaths. Lovely. I'm just going to take that across to the other side. Normal breaths, please. All right, that's excellent. All right, happy with that? Swing yourself round on the chair, please. That's great. That's it. That's it. Can I just? Sorry, I'm going to just have to bring your gown down a little. So just bring it down around your waist. All right. Are you feeling okay? Are you comfortable there? Good. All right. Let's go in and have a look at your chest area now. Okay. All right. This time, I'm just going to pop it on there. I want you to take a big, deep breath for me, please. Really deep. Hold it in for me. Slowly release it. And again. And slowly release it. All right. Let's go again on the other side. Bring that in. Deep breaths. And slowly release it. One more time for me. Big deep breath. And a slow release. Right. Oh, perfect. No, that's not a problem at all. Oh, I'm terribly sorry. It sounds like it started raining. You're going to get wet on your way out today, aren't you? Anyway, not to worry. Let's continue. So, the good news is everything is sounding very healthy around your chest area. So that's absolutely brilliant. You've done very well there. And you're eating well? Good. Exercising? How much exercise do you think you get a week? Okay. No, twice, I know. Listen, we'd all love to get to the gym a little bit more often, but twice a week is excellent. As long as you're making sure in between those gym sessions and work, you're perhaps getting out for a walk here and there, that would be really helpful. Sunday morning's walk. Well, there you are. I don't think I could ask for anything more, could I? Okay. Alright, what I'm going to have you do is just stand up for me. So I'm going to have you stand up, and then we're now going to move down your body and have a look at your lower half, alright? Alright, perfect. Honestly, you have absolutely nothing to worry about. Nothing at all. You're in very safe hands, aren't you? Of course you are. Alright, you just stand up for me, and I'm just going to get myself a bit more comfortable and get some other things that I need, alright? Alright, up you go. Alright, how are you doing up there? Lovely. Right, I'm just going to roll this up for you, alright? Don't be worried, it's absolutely fine. Will you hold it for me? Do you mind? Just hold that there. Round to the side so I've got a clear view. Thank you, that's lovely. Right, let's have a very quick check. Alright then. Are you feeling okay up there? Good. I just need to manoeuvre my light very fractionally. That's better, I think. Okay. Right then, let's have a little look in there. I've just got a few bits and pieces here. Now, the first part of this exam will just be a visual exam, okay? So I'm just going to be taking a look. I'll talk you through it as we go. So I'll be taking a look here around the sides of the groin. You'll just feel my gloves just gently pressing on the skin around the groin area. Alright, and the other side. That's it. Just gently pressing in. See? It's no problem. I'm just looking for any lumps, bumps, any abrasions, anything that is unusual and shouldn't really be around there. I'm just going to have to raise up your shaft, there we are, just moving that out of the way, just so that we can get a really good look at the scrotum area, which is very important when we're doing these men's health checks. Oh, it's alright. Right, put me down there. Alright, how are you feeling? You will tell me if you need a break at any time, won't you? I know that this can often feel very invasive. And I want you to know that you can take a break at any moment. Okay? Alright. Now, I'm just gonna take a few little measurements. I know that last time you came in, you were telling me there were a couple of changes. So shall we just take a look at that? Let's just... Can I just put this on? Just in the right position. These tools are always being used. Right. So I just want to take a little... Can I just gonna... Yeah, you had a very small lump, didn't you, that we looked at, and let me just take a look at that measurement. I know you had some checks on it, but it was nothing at all, just what we would call a lipoma, which are just small little fatty cells that sit under the skin. They don't do anything, they don't cause any issues. Sometimes, though, if they grow, we could obviously be concerned about that. Oh no, you'll be pleased to know it's actually shrunk. It's not even got larger. So that is nothing for you to worry about. Was that something you had a concern on? Listen, I assured you last time that there's absolutely no reason to worry at all. That's a very, very normal little lump under the skin. Lots of us have them. No. All right. Just going to move on then. I'm just going to actually have a look at the penis shaft now and just check that everything's all right there. So what I'll be doing is taking a look at, obviously, the skin surrounding it. We're going to just check that everything's all right with the foreskin moving backwards and forwards, and also just take a little look down the actual urethral tube just to make sure you've not got any changes. You've not noticed any, sorry, I'm going to have to get hold of you. Just going to hold you there. You've not noticed any unpleasant discharge or different smells recently, have you? No. Good. And in the shower you're washing with just water, right? You're not putting mountains of soap around there, because it can alter the pH balance of this area, and it's a very delicate area. No, good. All right. Just bear with me. I'm literally just going to have a look. That's it. Just need to look down the urethral tube. Everything seems absolutely fine there. I'm just going to very gently, I'm sorry, I know this is really tender. I'm just going to very gently pull back the skin so we can just take a little look underneath. That looks absolutely fine. Honestly, absolutely fine. No, not a problem at all. Now what I am going to do is, as I have you here and we explained, I know it's not the best part of anyone's day, but I am going to give you a very quick prostate exam as I have you here. And sometimes getting you back again can be difficult, so whilst I can take the advantage of you, and you're here in my surgery, I'm going to do a very quick checkup. I'm just going to double glove for this. All right. You've had a prostate exam before, have you? Good, good, good. You'll know what that's all about then. Just nice and ready. All right, what I'm going to have to ask you to do, if you don't mind, I'm just going to ask you to spin yourself around. Just lean forward very gently, placing one hand either side on my medical table. That's it. And you're just going to separate your legs about hip width apart for me. Lovely. No, that's great. And then also just breathing normally for me. Just breathing completely normally. Maybe even a slight bend in your knees. Yeah. All right. Just going to come in here. All right, my darling. Can you I'm just going to place a hand on your back, just leaning you into position. And you'll just feel a little bit of discomfort now. The cold gel just around the rectal area. All right, just bear with me a second. This won't take long. Just going to have a little quick feel. So just stay there for me. Breathing, just normally, please. Could you, if you wouldn't mind, just give me a little cough? All right, can you give me quite a deep cough? All right, and that's it. All done. All done and dusted. Nothing to worry about. Take a seat for me. Take a seat again, please. Right, let me move back for a minute. All right, let's just have a quick check. So, looking now at your notes. Okay, so, oh no, I think you'll be very pleased indeed to know that all is very well. Oh my goodness, no. Everything was fine there. Absolutely fine. Absolutely. My goodness. Oh gosh, if you were worrying about that, I'm terribly sorry. No. All clear. I'm not sending you for any further examination. I'm more than happy with what we've looked at today. So, moving forward, you can... Sorry. You don't have to stand there like that. Can I help you? Can we just take your gown down again? Put that down. Sorry. Bring that all the way down. Put that back into place. Right, take a seat again, please. Oh, sorry about that, making you stand there with everything hanging out. Take a seat for me. Right. Prostate exam completely clear. So tick that off your box, nothing to worry about there. All your other checks are very good. I'm so pleased you came in today. Nothing worries me more than when people don't just keep up with their checks. And how nice to go away with a completely clean bill of health. You did very, very well today. How are you feeling? I'm sure it can give you butterflies in your stomach. It is quite intrusive, but please, you're not the only man that's come in here. You won't be the last man I'll see today. You did very well. Very well. You can go home with a clean bill of health from me. Well done you. So what I'll do, send you a letter out in about a year's time. I'll just re-look at that and bring you in for another check-up, and hopefully you won't have any anxiety about coming in to see me again. Thank you very much. It's very nice to see you too. You take care and have a lovely day. And of course, if you did want to join any of my other pages, there is a Patreon, an OnlyFans, and also a ManyVids now as well. So you can go there and find a whole collection of videos that you of course wouldn't find on here.